Hi, I'm Dr. Jocelyn, and today I'm going to show you something that could genuinely change the way you manage your blood pressure. This is for anyone over 40, 50, 60, especially seniors who feel like their blood pressure is a constant battle. I'm about to show you something that might surprise you, something you've had with you your whole life that can lower your blood pressure in under 2 minutes. This is not medication. It's not a supplement. It's something free, always available, and completely under your control. Your breath. And I'm going to guide you through 3 specific techniques right now, counting every second so you can feel the difference as you practice. Over the last 2 decades as a cardiologist, I've watched patients avoid extra blood pressure medications just by using these methods. I've seen systolic pressure drop 15, even 20 points in just minutes, not hours. Here's the science behind why this works. Your breath directly influences your nervous system. Fast, shallow breathing triggers stress hormones and constricts blood vessels. Slow, deep breathing, on the other hand, activates relaxation, opens up blood vessels, and your blood pressure drops almost immediately. This is something the pharmaceutical industry doesn't advertise because there's no profit in teaching you how to breathe. But the research is undeniable. A study in the journal Hypertension showed that slow, mindful breathing lowered systolic pressure by an average of 15 points, equivalent to taking another blood pressure medication. The difference? This method is free, has 0 side effects, and you control it completely. By the end of this video, you'll have practiced all 3 techniques with me. You'll know exactly when to use each one and have a tool that works anywhere, anytime your pressure spikes. Let's begin with technique number 1, called 478 breathing. Developed by Dr. Andrew Weil, it's one of the most powerful relaxation techniques available. You'll breathe in through your nose for 4 counts, hold for 7 counts, and exhale through your mouth for 8 counts. That long exhale triggers your parasympathetic nervous system, the part of your body that says, relax, rest, digest, signaling your blood vessels to dilate and your blood pressure to drop. Let me give you an example. James is 72 years old, and whenever he got stressed, his blood pressure would spike to 165/95. Doctors kept increasing his medications, but the spikes still happened. I taught James 478 breathing. Within 2 minutes of practicing it, his pressure dropped to 140/85. Still a bit high, but 25 points lower than before. Over time, he began using this 4 times daily, and his baseline pressure improved. Less medication, more control, all through breathing. Now, let's do this together. Sit comfortably, spine straight, but relaxed. Place one hand on your belly. You should feel it rise when you breathe in. If you have a blood pressure monitor, check your pressure now and write it down so you can compare later. Empty your lungs, breathe out fully through your mouth, close your mouth, breathe in through your nose for 4 counts. Ready? Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Exhale slowly through your mouth. 1, 2, 3, 4, 5, 6, 7, 8. That's 1 complete cycle. We'll go through 3 more cycles together so your nervous system starts to relax and your blood pressure begins to settle naturally. Let's continue. After finishing those initial cycles of 478 breathing, notice how your heart rate feels slower, your shoulders more relaxed. Many people see a 5 to 10 point drop after just 4 cycles. The key is consistency. Do this 4 times daily, morning before getting out of bed, midday, late afternoon, and before sleep. Just 2 minutes each session, 8 minutes total daily, trains your nervous system to stay calm naturally. Now we move on to technique number 2, resonant breathing. This one is even simpler, and it's perfect for daily maintenance. You'll breathe in for 5 counts and exhale for 5 counts. No holding, no forced breaths, just smooth, steady breathing at 6 breaths per minute. This is the optimal rate for reducing blood pressure and balancing your autonomic nervous system. I want to tell you about Margaret, 76 years old. She had severe white coat syndrome. Every time she visited the doctor, her blood pressure would spike to 170/100 because of anxiety. At home, her readings were normal, but those doctor visits stressed her out. I taught her resonant breathing just 5 minutes before her appointments, and her blood pressure dropped to 135/82 at the office. Her doctor was astonished. This works because 6 breaths per minute create cardiovascular resonance. Your heart rate variability synchronizes with your breathing. Blood pressure drops, heart rate stabilizes, stress hormones decrease, and the beauty is you can do this anywhere, while sitting in your car, waiting for an appointment, or even watching TV. Nobody will know you're doing it, and your nervous system gets trained over time. Let's practice together. Hands on your belly again. Smooth, steady breaths. Inhale for 5 counts. 1, 2, 3, 4, 5. Exhale for 5 counts. 1, 2, 3, 4, 5. Continue naturally, in and out, keeping the rhythm relaxed. Don't force it. Let your body do what feels comfortable. In for 5. Out for 5. In for 5. Out for 5. Keep focusing on the rise and fall of your belly, the slow, gentle motion. With each breath, your body signals it's safe to relax. For maximum benefit, practice resonant breathing 5 to 10 minutes twice daily, morning and evening. You can set a timer on your phone or use a simple breathing app to stay consistent. The more you practice, the more your nervous system stays calm naturally, which lowers your baseline blood pressure over time. Unlike medication, which acts temporarily, this method trains your body to regulate itself naturally. Once you're comfortable with this technique, you'll notice more than just lower blood pressure. Your mind feels calmer, stress responses are less intense, and even your energy levels improve because your heart and lungs work more efficiently. This is the maintenance practice that keeps your cardiovascular system balanced and resilient. Over weeks, many seniors notice significant reductions in average pressure readings without adding new medications, simply because their nervous system learns to stay in a calmer state. Next, we're going to move to the most powerful technique for emergencies, when your blood pressure spikes and you need immediate relief. This is where alternate nostril breathing comes in, also known as Nadi Shodhana in yoga. Modern studies show it can reduce pressure even faster than the first 2 techniques. But before we dive in, take a moment to notice how you feel now, after practicing 478 and resonant breathing. Your heart rate should be steadier, your shoulders lighter, and your mind calmer. Now we move to technique number 3, alternate nostril breathing. This is the most powerful tool for emergencies, when your blood pressure spikes and you need immediate relief. This technique has been practiced for thousands of years in yoga and is called Nadi Shodhana. Modern research shows it can lower blood pressure faster than either 478 or resonant breathing. Let me give you an example. Robert is 68 years old, and his nighttime pressure would spike to 180/105. He would panic, which made it worse. I taught him alternate nostril breathing, and just 3 minutes later, his pressure dropped to 150/90. Still elevated, but much safer, preventing multiple emergency visits. Here's how it works. Using your right hand, your thumb will close your right nostril and your ring finger will close your left. Breathe in through your left nostril for 4 counts. Close your left nostril with your ring finger, release your thumb, and breathe out through your right nostril for 4 counts. Then breathe in through your right, close it with your thumb, open your left, and breathe out through your left nostril. 1 complete cycle. This process balances your nervous system, immediately reduces stress hormones, and forces slow, deep breathing, which is exactly what lowers blood pressure fast. Studies show this technique can drop pressure 10 to 15 points in just 5 minutes. Let's practice together. Sit comfortably, spine straight. Raise your right hand to your face, thumb for the right nostril, ring finger for the left. Rest your index and middle fingers on your forehead or fold them down. Close your right nostril with your thumb, inhale through the left for 4 counts. 1, 2, 3, 4. Close the left nostril with your ring finger, release the thumb, and exhale through the right for 4 counts. Inhale through the right. 1, 2, 3, 4. Close the right, open the left, exhale through the left for 4 counts. That's 1 cycle. We'll do 3 more cycles together. Close right, in through left, 1, 2, 3, 4. Close left, open right, out through right, 1, 2, 3, 4. In through right, 1, 2, 3, 4. Close right, open left, out through left, 1, 2, 3, 4. Repeat 2 more times at the same calm pace. Focus fully on your breath. Let it slow your heart and settle your mind. Notice the difference after just a few minutes. Your pressure should already feel lower, your heart rate steady, and your mind calmer. This is your emergency rescue tool, and it works anywhere. At home, at a doctor's office, even in stressful situations like traffic or unexpected news. Once you've practiced this technique, you have a complete toolkit. Technique 1, 478 breathing for daily nervous system training. Technique 2, resonant breathing for maintenance and long-term balance. Technique 3, alternate nostril breathing for immediate relief during stress or spikes. Seniors who combine these methods often see incredible results. For example, Susan, 73 years old, averaged 155/92 on 2 medications. She combined all 3 techniques, 478 breathing 4 times daily, resonant breathing 10 minutes every evening, and alternate nostril breathing whenever stressed. 3 months later, her average pressure dropped to 132/78. The same 2 medications, but now 23 points lower systolic pressure from breathing alone. Her doctor was surprised and agreed to hold off on a 3rd medication. Susan continues these daily practices and keeps her blood pressure controlled 2 years later. Now that you've practiced all 3 techniques, let's talk about how to use them strategically every day. The key is consistency. Technique 1, 478 breathing is your daily nervous system trainer. 4 times a day, morning before getting out of bed, mid-morning, late afternoon, and before sleep. 2 minutes each session, 8 minutes total daily. This simple routine trains your body to stay calm naturally, so your blood pressure spikes less often. Technique 2, resonant breathing, is for maintenance. Longer sessions, 5 to 10 minutes twice daily, morning and evening. This keeps your cardiovascular system balanced and reduces baseline stress over weeks. Seniors notice that their average pressure drops significantly without changing medications. The longer you practice, the more your nervous system resets to a calmer, healthier state. It's like building a foundation for your heart and blood vessels to function better naturally. Technique 3, alternate nostril breathing, is your rescue tool. Use it whenever your pressure spikes due to stress, anxiety, or a sudden panic. Just 5 minutes can bring dramatic changes in heart rate and pressure, preventing emergency visits and helping you regain control quickly. Imagine sitting in your living room, feeling pressure rising, and knowing you have a reliable, proven tool that works immediately. That's the power of your breath. Let me share another real-life example. Susan, 73 years old, was averaging 155/92 on 2 medications, and her doctor wanted to add a 3rd. She committed to 3 months of breathing techniques before increasing her medication. She did 478 breathing 4 times daily, resonant breathing every evening for 10 minutes, and alternate nostril breathing whenever she felt stressed. After 3 months, her average pressure dropped to 132/78. That's a 23-point systolic reduction, just from consistent breathing. Her doctor was impressed and agreed to hold off on additional medication. This demonstrates how powerful these techniques can be when practiced daily and strategically. The bottom line is simple. These methods work, but only with commitment. You can't expect permanent results from 1 or 2 sessions. Daily practice, like taking your medication, is essential. 10 to 15 minutes each day dedicated to proper breathing will gradually reset your nervous system and lower your baseline pressure. Slow, deep breathing activates your parasympathetic nervous system, the body's rest and digest response, which dilates blood vessels, lowers heart rate, and reduces stress hormones like cortisol and adrenaline. Over time, this becomes your new baseline. Your nervous system learns to stay calmer naturally, your blood pressure stabilizes, and your overall cardiovascular health improves. Here's your action plan. Step 1. Check your blood pressure now and write it down as a baseline. Step 2. Decide which technique to start with. New to breathing exercises? Start with resonant breathing. It's the simplest. Need immediate relief? Use alternate nostril breathing. Step 3. Practice for 5 minutes right now, set a timer, and focus fully on your breath. Step 4. Check your pressure afterward and compare it to your baseline. Many seniors notice a 5 to 10 point drop immediately, proof that it works. Step 5. Commit to daily practice with phone reminders or a set schedule, morning and evening, just like brushing your teeth. Step 6. Track your average pressure weekly. Most see improvements within 2 to 3 weeks. Step 7. Share your progress with your doctor. Show your log and discuss how consistent practice may allow reduction of medications over time. Finally, let's talk about safety and long-term consistency. These breathing techniques are safe for almost everyone. If you feel dizzy or lightheaded, simply slow down and don't force the breaths. If you have severe lung disease or COPD, check with your doctor first. These methods are meant to complement your medical treatment, not replace it. Very high blood pressure still requires medication, but these exercises often reduce how many medications you need over time. The bottom line is this: your breath is your most powerful tool for controlling blood pressure. Free, always available, with no side effects, and effective within minutes. James dropped spikes by 25 points using 478 breathing. Margaret conquered white coat syndrome with resonant breathing. Robert avoided emergency visits using alternate nostril breathing. Susan lowered her average pressure by 23 points and held it there for 2 years, all through consistent practice of these 3 techniques. Remember, the mechanism is simple but incredibly powerful. Slow, deep breathing activates your parasympathetic nervous system, the rest and digest system, which dilates blood vessels, lowers your heart rate, and reduces cortisol and adrenaline. With consistent practice, this becomes your baseline. Your nervous system resets to a calmer state, and your blood pressure stabilizes naturally. Daily dedication, just 10 to 15 minutes, is all it takes to make this part of your lifestyle. Here's your final action plan. Step 1. Check your pressure now and write it down as a baseline. Step 2. Pick a technique. Start with resonant breathing if new, alternate nostril breathing if you need immediate relief. Step 3. Practice 5 minutes right now, focus entirely on your breath, and set a timer. Step 4. Recheck your pressure afterward. Most people notice a 5 to 10 point drop immediately, giving proof these methods work. Step 5. Make this practice daily, morning and evening, non-negotiable like brushing your teeth. Step 6. Track weekly averages. Step 7. Discuss results with your doctor and explore medication reduction safely. Consistency is key. One session won't create lasting change, but daily practice rewires your nervous system to remain calm naturally, lowering stress-induced spikes and improving your cardiovascular health long-term. Think of it as training your body, just like exercise for your muscles, except this trains your heart and blood vessels to respond calmly under stress. Finally, don't underestimate the impact of your own breath. Hundreds of studies show its effectiveness, yet most doctors aren't trained to teach these techniques. Medical schools focus on medication and procedures, not on breath work. But with your own awareness and daily practice, you control this yourself. If this video gave you practical tools you can use immediately, share it with others who have high blood pressure. Make it part of your daily routine and encourage seniors around you to try it too. Your breath is free, it works in minutes, and it can change your life without any side effects. Thank you for practicing with me. Keep dedicating just a few minutes each day, and you'll notice the difference. Your heart, your blood pressure, and your overall health will thank you. I'll see you in the next video, where we continue teaching practical tools for controlling your health and living a calmer, healthier life. Remember, your breath is always with you, and with practice, it's your most powerful ally.